Hello, welcome back. Monica Estes with Innovative Endodontics. Today, we're going to continue our quest on asking the very best questions before joining an endo practice. And today I want to talk about schedule and patient flow. So understanding what your schedule will look like, what the expectations are so important. Firstly, we want to make sure that everybody's on the same page. So if you're going into a practice and they expect you to do 6 root canals a day right out of residency, and you don't feel like that is your capability, you certainly need to ask the question, what is expected of me as I start the practice, and what are the targets or goals as I move forward in practice? You want to make sure you have a place that is going to push you to increase your efficiency, but not have unrealistic expectations. The other thing you want to ask about your schedule is, what is the patient flow like with the practice? We touched upon this with the compensation question, but really you need to have a fundamental understanding of how is the schedule in the practice? How far are they booked out? Are they day to day? Do they have a full schedule for a week or two? And what does that mean for your schedule specifically? Sometimes people take on a doctor when they might not actually be ready for a full-time doctor. And so what that means sometimes is that the senior doctors, their schedules are filled as a priority, and then your schedule might get the leftovers or the crumbs. And so that might mean a full schedule sometimes, but it could mean an inconsistent or a light schedule more often than you would like. So you should have a firm understanding of what your schedule is expected to look like. And historically, you should be able to look back at their patient referral numbers. How many patients are coming in every single month? How many patients are scheduling? How many patients are converting to treatment? Those questions are vital to understanding what your schedule would look like in the practice. Anybody who's inviting you to join their practice should be more than happy to share those numbers because it's vital for you to understand what you are signing on for. So patient flow, schedule expectations, all of those things are very important topics that should be hashed out in the beginning so that you're joining a practice that you feel is aligned with your goals and your vision. So schedule and patient flow is the topic today. If you have any specific questions about that or anything else, please feel free to email me at monica@innoendo.com. Talk to you soon.